Good afternoon, I'm Chiao Suen. Thanks for joining us on ST Live. Now, as we learn more about the monkeypox outbreak, which has now been declared a global health emergency by the World Health Organization, we know that it can spread in different ways, person to person, through direct contact with the infectious rash, scabs, or body fluids. According to a new major study, the outbreak is primarily being driven by those in close physical contact between men. The New England Journal of Medicine found that of the 528 confirmed cases reviewed, 98% of infected people identified as gay or bisexual men, and 41% had HIV. This comes as the total number of monkeypox cases worldwide has ballooned to more than 16,000. It is also important to note that no one has died of monkeypox infection outside of Africa during the current outbreak. Singapore's health ministry has said that education and outreach to at-risk groups are important in reducing the spread. To find out more, we speak to Action for AIDS Singapore about how it is reaching out to men who have sex with men to help prevent the spread of monkeypox. Joining us is Professor Roy Chan, founder and president of Action for AIDS Singapore. Now, Prof. Chan, thank you so much for joining us. WHO has said that monkeypox is known to be transmitted by close contact, and men who have sex with men are more vulnerable. How will such individuals be affected, and how can we ensure that they are adequately protected?
Thanks, Suen, for inviting me. We are at the start of potentially an epidemic here in Singapore. We have a handful of cases thus far. There probably are a few more out there who are contacts and so on. I think what we really need to do now is increase the awareness of the disease, what it looks like, and how to prevent it in the community of men and sex with men, and to get the message out that they have to be careful. They have to look out for symptoms and signs when getting in contact with one another, and to make sure that if they feel unwell or they have what appears to be potentially this infection, they should seek treatment straight away and not fear going down to see the doctors or going down and seeking diagnosis. So that's very important. I think that we don't want to stigmatize the disease, stigmatize the people who are potentially infected. Otherwise, it's driven underground, and that's where the threat lies.
So how do we then balance between public safety needs and any worries about being viewed as unfairly singling out any particular community, especially as you mentioned, we don't want to create stigma?
Well, I think that we have to treat it as an infection and rather as HIV was in the initial years of the HIV epidemic, when it was treated as with moral judgment. I think that clear messaging is important. That's why we have already started engaging community partners in spreading the word. We've started having online meetings. We've started providing easy to understand healthcare public service announcements in 4 languages. So we've sent it out in soft copies. We're printing flyers to be distributed, posters as well. And we really need to engage the community to understand that this is something which can be prevented, and they should seek treatment straight away. If we, I think I mentioned this. If we start, stigmatizing people who are HIV, who are MSM, and who maybe have monkeypox in the clinic, I think that would be very bad to try to control it subsequently.
So you mentioned the HIV epidemic earlier. Are there any parallels that we can draw with it, and some lessons from how Singapore handled it then and what we can learn moving forward?
Thanks. That's an interesting comparison. HIV in the early days, we didn't know what it was, what caused it, until a few years later when the virus was discovered. Monkeypox, we know exactly what it is. It's slightly different also in the sense that there was no treatment initially for HIV. It was almost universally fatal. It had a much longer period of asymptomatic duration where spread was possible. Unlike monkeypox, it's a much shorter acute infection. And it's sort of, most of the time, it sort of clears on its own. So the total duration of the infection might be 2 months or 2 months plus. So we're slightly different, but at the same time, it affects the same communities in the initial period. So again, it's a very stigmatizing thing. It can be because of the fact that it appears on the skin as ulcers and ugly sores. It's again very stigmatizing. Like HIV, the lessons we learned from HIV, we always have to learn is that you cannot stigmatize a group of people who are most at risk, because that will make control and prevention much more difficult. And we've learned that lesson from HIV. We have to apply what we've learned to monkeypox as we are confronting it now.
Well, that's a very important lesson to have learned. Thank you so much, Professor Chan. Professor Roy Chan, founder and president, Action for AIDS. Our coverage continues on straitstimes.com and on Facebook as well as YouTube. Don't forget to hit subscribe to stay informed and activate the bell icon on YouTube to catch live news updates. I'm Chao Suen, and thank you for watching.